The pandemic is hitting Latinos in the U.S. particularly hard. Latinos account for more than 27% of deaths in coronavirus hotspots, but only about 18% of the population. And as Adriana Diaz shows us, the virus is also taking a financial toll on the community.
In Chicago's Latino neighborhood of Pilsen, people who are out of work and out of options line up hours early at this food pantry.
At this point, demand has outgrown our supply.
Family physician Dr. Evelyn Figueroa opened the pantry 2 years ago. But since the pandemic, demand is up by almost 50%.
Just as we've been standing here, I've seen people join the line.
This tells us that people are really on the fringe.
How are you managing?
It's a lot of word of mouth and hustle.
49% of Latino households have seen job losses or pay cuts in this pandemic. Latinos who still have a job face increased exposure to the virus because only 16% can work from home, the fewest of any ethnic group or race. People like this cleaning lady, who we agreed not to name because she's undocumented. She said, I wouldn't be able to take it if I brought this virus home to my children, especially because my son has asthma. So she's decided to stay at home. But now she and her husband, who works construction, have no income. And because they're undocumented, they don't qualify for unemployment, food stamps, or the federal stimulus. First-generation American Jose Gonzalez, whose parents are from Mexico, is also worried about getting his daughter sick. He works as a cook at a hotel housing COVID patients.
We don't have the benefit of I should just stay home to, not carry on such a high risk. And I feel like that's every Latino at this point.
Essential workers in many different domains, they are disproportionately made up of Latinos and other people of color. So they don't get the luxury of self-isolating and staying at home and flattening their own curve. They have to go out in order to get paid.
For CBS This Morning, Adriana Diaz, Chicago.